For the 17 million children and adults in the United States living with Attention Deficit Hyperactivity Disorder, or ADHD, the day-to-day can be a lifelong struggle. Join us today for some straight talk from leading experts in psychiatry, meaningful solutions for parents, and strategies for the management of ADHD. I'm Erica Vetrini. Access Health starts now. ADHD is the most common neurobehavioral disorder in children and adolescents, typically beginning in childhood and often lasting into adulthood. Studies show that ADHD affects certain areas of the brain that allow us to solve problems, plan ahead, understand others' actions, and control our impulses.
When Juliana was about 5 years old and in preschool, we noticed that she was very hyperactive. She'd always be moving. She had a very difficult time staying still when we asked her to. And she also had a very difficult time focusing on very simple tasks like, Juliana, please go get your shoes on, and 5 minutes would go by and her shoes still aren't on. And her father has ADHD, so we kind of knew what signs to look for. And Juliana, although she's extremely smart, she had a lot of these same trademark challenges.
My name is Juliana, and I have ADHD. ADHD to me means my brain works differently than others. It's like the door is always open, and I can't close it. When I was little, I couldn't pay attention to anything, so it was hard for me to do the one thing that I'm supposed to do when there were so many other things that I wanted to do.
I was actually pretty scared because I didn't know what Juliana had. I didn't know if she had ADHD or something else, and at that point I didn't know how I could help her if she did have ADHD. And the more I researched it, the more I saw Juliana in the descriptions. Impulsivity, hyperactive, inattention, all those things were Juliana. We were getting emails from her teacher about her behavior in school. At this point, it was affecting the way that she was learning at school. She'd constantly be getting out of her seat when she wasn't supposed to. Instead of raising her hand, if she had a question, she would just call out. She was very impulsive. And she was very hyperactive, wouldn't stay still in her spot, wouldn't raise her hand when she had a question or a comment. And so she'd be getting into trouble for basically being herself. Which I felt really horrible about, because a kid should never have to feel that way. Mornings for her are really hard. I always had to constantly be after Juliana. I couldn't just tell her to go get her shoes on. I had to go and make sure she got her shoes on. I couldn't trust her to do what I had asked. That's very overwhelming because you think you told your child to do something and it's handled, but it's never handled. So her pediatrician recommended that we go see a behavioral therapist. So Juliana learned a lot of great coping mechanisms to help her deal with some of the more intense emotions that come with ADHD. I knew that she was having very low self-esteem and self-confidence because she felt like she could never do anything right because people were always correcting her, whether it was me or her teachers. So sometimes she just felt like she could never do anything right, and she was very hard on herself.
I just felt very confused because I didn't no idea why they were mad. I felt like I was getting in trouble. It made me sad because I did not know what I was doing.
My husband and I, as well as her kindergarten teacher, had a questionnaire to fill out about Juliana's behavior. And then the behavioral therapist assessed all of our answers. And she also met with Juliana a couple of times before she made the diagnosis that Juliana has ADHD.
Living with ADHD can be challenging for families. To talk about these challenges, today we have author, parent educator, and coach Elaine Taylor-Klaus with us. Welcome, Elaine. So happy to have you here.
Thanks, it's great to be here.
So let's jump right in. I know you have a very personal story when it comes to ADHD.
I am the mom in an ADHD family of 5. So there's a lot happening in my world on any given day.
As a mom, I face many challenges on a regular basis, but I can only imagine that those challenges just must be so much tougher when you have a child with ADHD.
It's kind of like parenting on steroids, right? Everything is, the highs are higher and the lows are lower. So kids with ADHD tend to have challenges in kind of 5 key areas. Your typical ones that you see, in the media are focus issues, right? Kids who don't pay attention, kids who are sort of distracted and looking out the window, or hyper-focusing and can't get off of technology. And then hyperactivity is a really common one that people refer to a lot. There's the kids who are kind of bouncing off the walls and talking 1,000 miles a minute. But we also see organization issues, kids with emotional regulation issues, kids who have a hard time, they have a lot of meltdowns and tantrums and that kind of thing. And then impulsivity is really, really common, shows up for a lot of kids, that tendency to act before they think, right? And so they don't sort of think sequentially, they don't plan things out. They will run into the street, or they will blurt out in class because they're excited about it, but it's still interrupting.
The first thing that comes to mind is me trying to get my kids, and I only have 2.
Yeah.
They don't have ADHD.
That's a lot. 2 is a lot.
You're right, it is. Sometimes it feels like 10. And just getting them ready in the morning, getting them out the door, or even just for an after-school activity, trying to make sure they have all of their things. I mean, I can imagine that those challenges are amplified with children who have ADHD.
Significantly, right. I mean, the 3 times a day that we hear from parents that are the most challenging are mornings, after school / homework time, and bedtime. And those are all generally times when there's kind of a time limit, right? You only have a certain amount of time to get it done, whatever it is. And there's this sort of pull between, I want to meet my kid where they are and help them, and I got to get out the door, or I got to get them, I got to get them to bed. So it's really stressful on parents.
Yeah. So how do you approach it?
We teach what we call a coach approach. So, and what happened for me is when I got coaching and then I became a coach, I became a better parent for my kids, and I realized it wasn't rocket science. It was really just about how I was communicating with them and how I began to shift my approach to really empower them to take ownership of their lives.
Elaine, you're going to stay with us. We have much more to cover when we return. Welcome back to this special edition of Access Health. I'm back with Elaine Taylor-Klaus. Elaine, we spoke earlier about how complex ADHD is. So how do parents handle it?
Well, I think the key word is management, and then learning skills and tools and strategies so that we can help our kids understand themselves and learn the skills that they need to manage ADHD, because they're going to be living with this, most of them, for the rest of their lives. So we want to set them up for long-term success. And ultimately, that sort of transferring of ownership is called behavior therapy.
That is such good advice. And speaking of management, we had a chance to speak with Dr. Birgit Amann, a psychiatrist specializing in child, adolescent, and adult behavioral therapy. Take a look.
So here at the Behavioral Medical Center, we treat depression, anxiety, ADHD, and in general, we treat conditions across the lifespan.
How are you? Good, how are you?
When a family comes in for behavioral therapy, a lot of times they might feel like they're in crisis. They feel like, oh my gosh, when we're sitting down trying to do homework at night, my child is angry and impulsive and blows up quickly, and then I get angry and blow up quickly, and it really becomes a real intense, heated environment, very difficult. And so one of the goals of behavioral therapy is helping the parents as well as the child temper that. And it takes practice and it takes work. And so we need the whole family as a unit to work at it to achieve success. I think before the parent comes to the first visit, they've probably generated some concerns already and some questions and certainly some wishes. I want this to get better really quickly. They're getting pressure probably from the school. So when we try to get a good history and then we give them rating scales, we'll talk about that when they do the rating scales. We really want to understand all parts of the day. So a rating scale may ask the standard questions that are about focus and concentration and fidgetiness, restlessness, impulsivity, and that's all important to make the diagnosis. We want to make sure that the behavioral therapy is individualized because it's not a one-size-fits-all, and we want to understand by those rating scales in the history, where are they having the biggest difficulty so that the behavioral therapy can address mornings, evenings, or wherever that is.
Homework was probably the biggest issue that we had with Juliana before she had the diagnosis. I didn't understand why she was having such a hard time just sitting still and completing her homework. I would get frustrated and angry, and I would feel guilty, about getting mad at her. And I felt like I was punishing her for things that she couldn't help because I didn't understand ADHD. Once in a while, Juliana might become frustrated with something, like she can't do something that her peers can do, or if she just doesn't understand, a certain math problem. She'll get these meltdowns, just cry and scream. It's not a tantrum, it's like a meltdown, because it's a lot more mental for her. So when she has those, then I'll ask her to take a break. So we have this calm down area in our house where both Juliana and Annabella can use if they just need some time for themselves. We have this calming swinging chair, and we have a whole box of fidgets and squishies. And we have these books for them. A lot of the books are about ADHD. If Juliana needs to understand, why is my brain doing this, or why do I behave like this when I really don't want to. And they're actually good for Annabella too, because it helps her understand her sister better. So we tried all of these tactics to help Juliana manage her ADHD, but she goes to school, for 8 hours a day, so she needed something more. That's why we decided to put her on ADHD medication. So we met with the child psychiatrist and we went over Juliana's ADHD, and so we tried a small dose of ADHD medication for her. We do still have some difficulties, getting up out of bed, the whole executive functioning of it. I kind of do still need to go in and be the general and make sure that she's on task before that medication is in her system. The night before, we try to get as much as we can done so our mornings aren't crazy. So all the homework, as soon as it's done, goes back into the backpack so it's ready to go. I also make their lunches the night before, so all they have to do in the morning is just put it in their lunch bag, put their lunch bag in their backpack, and that's ready to go. And then I also lay out the clothes that they're gonna wear for them the next day, so that cuts time. And we put these little keychain reminders on her backpack that you're able to write on, because she was forgetting a lot of things sometimes, like her sweater or her jacket or her water bottle, and sometimes even her whole lunchbox. So we put all those reminders on there, and then Juliana at school would go through it to make sure that she got everything.
I think it's so important to educate families and the child or adolescent that they can't count on one or the other to do it all. A medication is going to help some aspects, but it's not going to help organization. They need behavioral therapy to learn how to get organized, not have those missing assignments, be ready for the next day. And those are tips and strategies. Those are tools in the toolkit that they're going to have for the rest of their life.
ADHD is one of the most common and one of the most treatable disorders in all of medicine, particularly for children and particularly in child psychiatry. If you recognize it, you should be able to treat it. ADHD medications are some of the most studied and best documented treatments of any psychiatric disorder we have today. A lot of people don't like the idea of treating children with anything, and actually, quite frankly, neither do I. So you do it reluctantly, but these disorders that are hyperactive, inattention, impulsivity, are disabling, can stand in the way of peer relationships and getting an education. So it's not funny and it's not trivial. And to be able to have the ability to actually go to school or stay in class or stay in your seat and actually have friends or not, that's a pretty big swing. And so you do see that with these medications in children with ADHD and in adults with ADHD. There are different ways to tune the brain circuits with the amount of dopamine or norepinephrine that you have. And we use stimulants and non-stimulants to do that. The most common problems are at the very beginning or the very end of the day. When you give medicines when you wake up, usually during the school day, it has kicked in, and if you give one of the longer acting forms, of which there are many, it'll last until you go home. And so that's not the problem. The problem is before you go to school and after you get home. And it's not so much which stimulant, is how stimulant. So one of the tricks has been to try to find ways to keep the medicine on as soon as you need it, as long as you need it, and have it drop off as soon as you don't need it. That's not what a normal pill does. So that's led to technologies to try to essentially find a way to start it quickly and keep it going without pause. I think there are unmet needs in ADHD treatment to more completely abolish all symptoms for the longest period of time while you're awake.
We began giving her just a small dose of medication in the morning to help her get through the day, but we soon realized that it wasn't enough to get her through the day. So we consulted with a child psychiatrist and we increased the dosage by a little bit in the morning, and then she got a boost later on in the day to help her get through the rest of the day. So it was a combination of behavioral therapy and medication that helped Juliana get on track with her ADHD.
Well, I do take my medicine, which helps me focus better. It just helps you pay attention to only one thing that you're supposed to be paying attention to.
So one of the things I tell Juliana is that her ADHD gives her superpowers. And when kids or adults with ADHD are passionate about something, they're able to hyper-focus on their work. So Juliana will focus just on her art at her desk for hours and hours.
Whenever I would draw a picture, a lot of people would tell me, "Oh, that's really good." And then it would make me have higher self-esteem.
I would try to involve the whole family if you can, to make sure that the entire family understands what ADHD is and understands that you do need to make behavior modifications and look to coaching and also possibly medication for your child. And you should never be ashamed that your child has ADHD. It's nothing that you did, it's nothing that you caused. And try to always see the positives, because ADHD, when managed correctly, can be a pretty amazing thing. And like I tell Juliana, it's a superpower.
Welcome back. We've been discussing the chronic disorder ADHD today, and still with me is Elaine Taylor-Klaus. Elaine, earlier in the show we were talking about those high stress moments early in the morning, getting ready for school, or bedtime, when there's a lot of moving parts. Do you have any tips for how to manage those times of the day?
So there are a couple of strategies I really encourage parents to use to really think about their mindset and how they're approaching things, because it really has a great impact for the kids, okay?
Okay.
So the first one is to ask yourself the question, is it naughty or neurological? Mm-hmm. So oftentimes when our kids aren't doing what we ask them to do, and we start to take it personally and we feel like they're not listening to us, or they're being disrespectful, or they're not following our directions, we kind of make it about us, if you think about it. And when we shift it and think, is it naughty or neurological, it's no longer they're being naughty. We realize they're struggling with something, and oh, I can help them with that. Mm-hmm. I can have compassion for that. I can support them in learning how to manage that.
And patience.
And patience in it, right? So when we're not kind of judging the behavior, it really enables us to support them much more effectively.
Elaine, thank you so much. Such great information for parents out there who are managing ADHD. And also you created a tremendous amount of empathy for those of us who aren't. So I really appreciate that. We also want to thank everyone who helped us tell this story. And for more information on the topics and resources available, please visit us at accesshealth.tv.